scare for a patient being monitored for Ebola symptoms is raising questions about how the exposed patients are monitored in Omaha. Tonight, this patient is in stable condition after a medical emergency near the Med Center campus. Good evening, I'm Megan Matthews.
I'm Kevin Boughton. Reporter Kelly Bartnick is live at Nebraska Medicine with the story tonight. Kelly?
Kevin, we want to be clear. The patient was exposed to Ebola and is being monitored for it, but has not shown any symptoms and has tested negative for the virus. Now, the patient was on a run here, a jog around the Med Center. Med Center staff say it's something that the patients are allowed to do. Today, the Med Center hit the ground running with that message, hoping to calm some fears. These young college healthcare administration workers are picnicking on a spring day and learning what happened down the street.
A little bit taken aback, but and concerned about the situation.
Nebraska Medicine confirmed Sunday that one of the 5 Omaha patients monitored for Ebola exposure in West Africa had a cardiac issue Saturday jogging outside near the Med Center. A bystander who is also a healthcare worker was near the patient and started chest compressions.
I think that we have to do what we can, we have the resources and the people to help, then I don't know why we wouldn't. And I think that's really awesome that healthcare worker was there and, that was their first response to help them and they're trained to do it.
The patient is now in stable condition at the hospital. People had questions for the Med Center Sunday about possible Ebola exposure and procedures allowing the patients being monitored out into the community.
People just want to know what's going on about it, so they have a lot of questions.
Med Center doctors say there is no danger. Biocontainment Medical Director Phil Smith released this statement today saying, quote, "Out of an abundance of caution, we ran an Ebola test immediately after the patient was admitted on Saturday. That test came back negative. There is no risk to hospital staff, patients, those assisting at the scene, or the public."
It's such a big deal, but at the same time, we need to trust the staff that's put on the case.
The patient arrived earlier this month. All patients are monitored for 21 days. A Nebraska Medicine spokesperson says per CDC guidelines, after 14 days with no symptoms, patients face fewer restrictions. Walking and jogging are allowed if they stay 3 feet away from others. The patients are monitored twice daily for any possible Ebola symptoms. So far, none of those staying in Omaha have had any symptoms at all. Now, I also put a call into the Douglas County Health Department today who echoes the doctors here at the Med Center saying, again, because that patient has not had any symptoms and has tested negative, there is no danger to the public. Reporting live at the Med Center tonight, Kelly Bartnick, Action 3 News.